Experts suggest that booster shots may help extend the effects of the COVID-19 vaccine, and those who received the Johnson & Johnson vaccine at least 2 months ago are now eligible for the booster shot. If you choose to take Johnson & Johnson's booster, you might be wondering what potential side effects you should expect. According to clinical trial data and experts, injection site pain is the most common side effect among those vaccinated with the Johnson & Johnson vaccine or booster. Note that regardless of which vaccine or booster you get, the vaccine is injected into the deltoid muscle of the arm, the area of the arm largely responsible for range of motion. Subsequent pain, swelling, and redness at the booster shot injection site can happen for various reasons. One reason may be due to an immune response initiated by the vaccine. In a nutshell, the science behind the vaccine is to make our bodies think we've been infected by the virus. In trying to defend our bodies, our immune system sends white blood cells to fight the invader. This can cause inflammation and pain as a result. Arm pain is generally harmless, albeit annoying, but it typically resolves within a few days. In order to minimize the pain, it's recommended to apply a cold compress and exercise the arm frequently. Fatigue and headaches are also categorized as mild side effects of the Johnson & Johnson booster shot. Clinical trial data showed that about 29% of adults 60 and older experienced these two side effects after getting the booster. As such, many have turned to over-the-counter medications to help alleviate the pain. However, it's suggested by the CDC that these medications be used only as needed after receiving the booster shot, rather than before the shot as a preventative measure. Additionally, anyone considering over-the-counter medications should consult their physician first, as some individuals may have medical conditions that make such medications unsafe to take. Interestingly, when it came to individuals with post-vaccine fatigue, researchers suggested the placebo effect may have been to blame. One study showed that 23% of participants complained of fatigue after receiving a placebo dose of the COVID-19 vaccine. The same could conceivably hold true for the booster shot. Muscle aches are considered a common side effect of the Johnson & Johnson vaccine and booster. This may manifest as a dull ache and pain that radiates throughout the body. Similar to a headache, it's recommended that those experiencing body aches consider using over-the-counter pain relief to manage the discomfort. Other simple ways to alleviate body pain can include a cool bath or soaking in Epsom salts. In addition to muscle aches, nausea is another uncomfortable and common side effect of the vaccine and booster shot. Simple ways to minimize nausea include drinking plenty of fluids that replenish electrolytes. While nausea can be a symptom of the booster, it's also a common symptom of general dehydration. If you're not feeling well to begin with, you may be drinking fewer fluids than normal. Muscle aches and nausea both typically resolve in 1 to 2 days and are generally not considered dangerous or life-threatening. Fainting has been reported as a possible yet uncommon side effect of the Johnson & Johnson shot. Health experts suggest this has less to do with the vaccine itself and more to do with the anxiety surrounding any shot or vaccination. Additionally, allergic reactions may occur as a result of the booster shot. One such reaction is anaphylaxis, a life-threatening allergic reaction. Compared to the Moderna and Pfizer vaccine, there are fewer reported cases of allergic reactions in the Johnson & Johnson vaccinated population. It's recommended that if you had an allergic reaction to an initial dose of the vaccine, you should not get another dose of the same brand. While common side effects may affect daily living, they shouldn't last more than a few days. Adverse effects, on the other hand, can pose a dangerous health risk. One adverse risk associated with the Johnson & Johnson COVID-19 vaccine and booster is toxic shock syndrome. TSS is a serious type of blood clotting disorder that presents in tandem with low blood platelets. People who developed TSS after receiving the Johnson & Johnson vaccine developed symptoms 1 to 2 weeks later. This condition has been most highly reported by women between the ages of 18 and 49. Another serious side effect, called Guillain-Barré syndrome, a severe neurological disorder, has been reported within 42 days of receiving the Johnson & Johnson COVID-19 vaccine.
It's pretty rare in general and can be caused by can be triggered by other infections. It has been known to be triggered by medicines or even other vaccines.
Other serious side effects that require emergency care include shortness of breath, stomach pain that won't go away, severe headaches and blurred vision, pain in the chest, and swelling of the legs. It's important to remember, however, that adverse effects are incredibly rare, and mainstream medical advice suggests that it is not worth refusing a vaccine or booster shot in order to avoid that risk. Check out one of our newest videos right here. Plus, even more Health Digest videos about your favorite stuff are coming soon. Subscribe to our YouTube channel and hit the bell so you don't miss a single one.